All right, this is Dr. Kevin Christie, and as many of you have probably noticed on some of my social media, I've been posting some of the information on the NFL Combine program that I'm part of. And as the clinical director, I'm going on my 10th year of doing this for the NFL Combine, and I'll be going to Indianapolis March 1st for the 10th time, which is exciting. It's always been something new every time I go. But the point of what I wanted to discuss on how this has improved me as a clinician in many different ways and the experiences that I've had. If you're unfamiliar with the NFL Combine prep program, essentially it's about 8 to 10 weeks depending on the player and if they had a bowl game or not and different other variables that are out there. And they train for everything from the 40-yard dash, the bench press, to losing weight, gaining weight, IQ tests, to prep for interviews. In our office, we actually have former GMs come and teach interview skills to some of the players. It's medical is a big part of it. When these players go to Indianapolis or their pro day, the medical aspect of this player is extremely important because obviously these teams are investing or potentially investing a lot of money into them, and they want to know their past medical history and their current medical history. So that's where my responsibility lies with our players as the clinical director for XPE Sports. And now they have 2 locations. So they're in Boca Raton, where my main office is, and they're also in Fort Lauderdale. So for this year, I have about 50 football players that I'm in charge of some of their health care, whether it's directly and I'm treating them or I'm referring them to some of our network doctors that we have, and just really trying to make sure when we have them for 8 weeks, we get them healthy if they come to us injured or in pain, or if they go to one of these Senior Bowl games, or a lot of times they get banged up from that, so get them healthy from that. Keep them healthy, guide them as far as how to keep their bodies healthy, because this is training that they're not used to. This is not football training. This is more like track and field training, and so it's a little bit different, and so it's really a lot to keep up with. And one of the keys is communication with both the player, the other medical providers, and the training staff to really ensure that they are doing everything they can to keep their bodies healthy. So right off the bat, one of the things it's done for me clinically that's really helped is that it's trained me over the 10 years inherently to understand and examine different types of sports injuries. I feel like I've learned a lot that maybe I didn't even learn in school or after that in some of the post-grad certifications to examine significant injuries sometimes, like knee injuries and shoulder stuff. And so orthopedically, I feel like I know enough to know when I don't know enough, right? So I know what I don't know now, so I can examine someone and say, everything seems pretty good, but I'm not sure. So I know when to refer to an orthopedic specialist. And that's a key cog in the wheel of our team are the specialists that we refer to when we may have an issue that comes in. And so I do feel like it's helped me evaluate sports injuries a lot better over the years. It's kind of force fed me. I started out when I was probably 2 years out of school, and it's just been a long process of trying to hone in those examination skills of sports injuries, whether it's a hamstring strain, a knee sprain, shoulder injury, things of that nature. So that's been one key aspect for me. The second is treatment of sports injuries. I definitely feel like it's helped me improve as a clinician from a manual treatment, whether it's the adjustment side of things, like adjusting some of these large athletes can be difficult. So it's helped me with that, but also with the soft tissue treatment we do, with the rehab exercises, with the other modalities that we try to always be on the forefront of the technology that's going to improve sports injuries for these players. So then I know that can carry over to my regular patient base as well. So that's the treatment side of things has been very, very helpful also. Third is developing timelines, right? Because that's a big part of injuries is I get a lot of regular patients or these combine players ask me, well, like, when am I going to be able to run again? When am I going to be able to golf or, whatever it is. But obviously for this particular scenario with these combine athletes is we have short windows that get them better. And I've improved over the years in developing my timelines. Okay, this hamstring strain, probably 1 to 2 weeks, or this one we actually need to rest completely for 2 weeks, and being able to communicate that with the player, sometimes with the agent, a lot of times with always with the training staff that works with them, and there's a lot of communication that goes back and forth with them. But developing timelines of return to sport or activity and training is something that goes unnoticed a lot, and that puts this type of scenario puts us in a lot of timeline types of situations. And I think as a regular patient, it's always nice to have a timeline as well as, okay, when am I going to get better? When can I get back to this, even if it's just work? And so developing timelines was another key aspect. And then fourth, I kind of referenced it earlier, is when to refer out. I think that's a big mistake a lot of clinicians make, is they don't refer out appropriately or in a timely manner. And that could be anything from referring out for proper imaging to a right specialist to someone that's maybe in the same type of conservative care as you, but knowing, okay, this is the physical therapist deal right now that we need you to see, or we need you to see the acupuncturist or the massage therapist, or just stick with me for right now. So being able to refer out has been very, very instrumental in this process for me. The next thing that I've learned in general, that's outside of the clinical side of things, but it kind of ties in, is communication with trainers, right? So Tony Villani, Bill Welly, and his trainers are in Boca, and then Matt Gates is in Fort Lauderdale. I've had to really make sure that I communicate well with them on these injuries, and the communication between the medical entities that we have on staff and then the communication with the training staff is extremely important to make sure that this player returns quickly, effectively, and is not going to cause more damage. And so I think understanding that communication with other trainers on that particular player or just client in the regular setting has been something that I've developed over the years. It's been very helpful to carry over into the general population. Okay. Third, and one of the big ones that I really feel strongly about is the stress of it. Right. So this can be very stressful. We've had injuries already this year, that people coming in from bowl games or from the season. A lot of these guys are injured from the season, and we have to get them ready. And then we go to Indianapolis, and it's just, there's so much pressure on these young athletes, and it kind of carries over to us. But over the years, I've been able to really maintain low stress, be accommodating for the player, try to convey a sense of confidence in what they're being diagnosed with, what the treatment plan is going to be, and how they're going to achieve their goals. And I think that lack of freaking out, like maybe early on happened, has been beneficial to carry over into my patient base as well. So just kind of managing the stress of it's been helpful also. So it's just overall been a very good learning experience. I get a lot of clinicians or a lot of patients that ask me about it. So I usually talk to them about what I do and how it helps. But I think it's done a great job for me over the 10 years of doing it to be a better clinician. And I continue to do it, continue to grow. I think that's one of the exciting things about my profession, is that it's a never-ending learning process, and just Combine program is something that really helps accelerate that for me and make sure I'm on top of my game. So that's my little NFL Combine wrap-up of what it's done for me as a person, as a clinician. I hope you find a little bit of value in that, and it's definitely exciting. 2 weeks I leave for the Combine coming up, so these next 2 weeks will be stressful, but I'll try to manage it better. Have a great week, and I'll talk to you later.